All right, let's go. Hey, welcome to the Jetset Physical Therapy Podcast. We're here with Jay Bott. What's
Hey,
up?
what's
We're
up? How
here
are
with
you, everyone?
Neema, the
Hey
founder
guys.
and CEO of Ion Pharmacy. Is that correct?
Yes, it is. Thank you,
Yeah.
Randy.
Okay, perfect.
Yep.
And it's not like a normal pharmacy. So this isn't like
That's
like
right. Yeah,
CVS, right? This is I don't know what you call it, but it's like a concierge pharmacy.
I would say it's an integrative and compounding pharmacy.
Okay. What does that
So,
mean?
well, my background is integrative and personalized medicine, and a big part of what I do is look at health as one connected system, not just individual symptoms.
Mhm.
And so we review like medication. We also do consulting. So we review medications, hormones, nutrition, lifestyle, inflammation, how these all affect each other. So you're right, Randy. It's not like your typical, you know, community or CVS pharmacy. It's more looking at the picture as a whole. A lot of the times in healthcare, we treat one thing without realizing how it impacts another, right?
Mhm.
So my role is to connect those dots. And that's why I think conversations like this one that we're having today are important because medications can directly affect movement, they can affect recovery, pain, energy, and overall outcomes in physical therapy. And so I thought
Mhm.
that this would be a really great topic to cover today.
Yeah, and what I was telling you when I was asking you to be on the show, I was like, we don't have a huge amount of education in pharmaceuticals as well. So I don't know. I feel like sometimes a lot of my information is most of my information is just from like talking to doctors,
Mm,
and then what I have another friend that's a pharmacist, and he was telling me like, man, like if I just prescribe meds the same way that doctors do, like I would have had like 4 people die this week. Because I don't know if people know this, but the pharmacists are always putting the guardrails on what the doctors are ordering because sometimes these meds have interactions. And I would trust pharmacists a lot more with my meds than anybody else.
Sure, Randy, and that's happening in the background. So there's oftentimes the pharmacist will put their foot down on maybe a dose that they feel is a little too high, drug interactions that come up given their knowledge that they know what else the patient is taking. Sometimes even it could be a supplement or a vitamin you're taking. So it's very important to have a great pharmacist that you're close to. Um, Keep always a good regimen, of what you're taking, or recording what you're taking, and making sure that everything is in alignment with helping you recover from maybe an injury you're having, or really getting the best out of your physical therapy based on your drug regimen.
Oh, Randall, we lost your sound.
Sounds there. Is that better?
There
Can
you
you
go.
guys hear me now?
Yeah, I can hear
Yeah.
you. Yeah.
I didn't say anything good anyways. The big thing, it is a hot topic right now, I guess, is GLP-1s. And I was wondering if you could give us a kind of a brief overview on those, like what are they? And I'm sure Jay has some other questions about those as well.
Right. So I'm going to be getting into a lot of different medications. The information discussed today is for educational purposes only and should not replace individualized medical advice. But GLP-1 agonists, which is what you'd see with Wegovy and tirzepatide and a lot of these common weight loss drugs, what they do is mimic GLP-1 hormones to increase insulin. They slow gastric emptying and they reduce appetite. So these were commonly used for type 2 diabetes, obesity, and metabolic syndrome, but they've also been known to help with a lot of other ailments, right? And so some common side effects of GLP-1s could be nausea, constipation, dehydration, fatigue. Now, the important fact is that rapid weight loss can also cause lean muscle loss. And that's something that is
Mm-hmm.
a huge topic right now. How do we lose weight without losing strength, without losing that muscle? And that's, finding that perfect balance is what many prescribers, patients, pharmacists, physical therapists, and many other healthcare professionals are helping patients do. Um, So, I guess this is kind of more for maybe Jay or Randy, where the physical therapy tie-in, where the pharmacy and physical therapy will kind of overlap here, is that there's less stress on the joints, but preserving muscle mass is also critical. And so, what do you kind of see with people that are taking GLP-1s, like Ozempic and such, and with in the physical therapy and how it affects them?
I mean, the first thing I notice is their appearance. They almost look sick sometimes, and maybe I think a lot of people that are lose a lot of weight. I mean, I guess that's what they look like. So I don't know if that's necessarily unhealthy. But I haven't been able to identify like, wow, they're so much weaker since they've been taking that. Sometimes there's so much weight loss that it's really hard to tell for me.
Yeah, I'll say I'm really glad you're on this call because and just our podcast, because it's like one of the things that is emerging. These studies and stuff are just coming out. Like, obviously there's a huge uptake now. Like the stuff I've read, like it's like 1 in 8 patients or 1 in 8 adults are on this.
Right.
I could see that trending because to your point from earlier, they're finding all sorts of uses for these, right? So it's not just weight loss anymore. Now they're talking. There's been some stuff which has come out in the news, and again, I don't know how true it is, but they're talking about Alzheimer's. That there's stuff around that. There's Parkinson's. There's various things that they're playing around with. I'm sure that they're going to have to figure out like the side effects on using it on those kind of populations and stuff. And so probably a lot more research has to be done. But what really sticks out to me is these are being prescribed right now, and they're doing wonderful things with regards to metabolic syndromes and things of that nature. And you're seeing weight loss, which is amazing. But then the interesting thing, like I was reading a study actually before this call here today, and one of the things they were talking about was there, to your point, there's muscle mass loss because it's not specific. It's you're losing weight, right?
Right.
As part of this, and so there's muscle loss, in the they're finding some bone loss, very very little, at least from the study I saw, but it's like what to your point, I love your philosophy. You're integrative, so you're looking at the whole individual and the whole person. Um, you know, I I think some of these decisions right now are being made kind of in a vacuum. It's like, hey, we've got to get your diabetes under control. We got to get your metabolic syndromes under control. But
Right.
where does but it's like, how are we going to make sure you don't end up with sarcopenia, you don't end up with these muscle issues. Um, because the interesting thing on one of these other studies, which I found also, was that they're showing that people who go on this are actually exercising less, which you don't want, right? You've got to
Right.
combat that.
Right.
So it's like, how are you going to offset that? Because I can see a person going on and being like, oh, great, look, I'm going to lose weight I got a pill. I don't have to work out. I'm
That's
going to
right.
lose my weight. But
Right.
they're not taking into consideration all these other things which are going on, the systemic issues that you'd like to, talk about and address with some of the work that you do.
Sure. And diet and lifestyle modifications are supposed to be a huge part of taking these weight loss drugs. And it is of concern that I see so many patients that are just, you know, pulling away from the diet and the exercise, and the nutrition is so important. And being active is so important, right? And so it's supposed to be, the concept is you're supposed to use those along with the medication, which is, again, the integrative approach, to help you lose weight, to decrease inflammation in the body, to help your insulin levels, and so on and so forth. But, sometimes that's overseen. One question I have for you guys that I was always wondering is, when they lose muscle, do you tend to
Hmm.
see in physical therapy that it also affects their balance in maybe recoveries from injury and such?
I think balance and strength are like very closely correlated, but
Okay.
there's not like a causation that's been
Okay.
identified. But I'll tell you that if somebody's a little bit more on the elderly side and they lose a little bit of strength, I see like a bigger balance problem than in somebody that would be, in their 40s and 50s taking these GLPs. That's my
Right.
clinical experience. The research is still coming out on this because it's such a new plan of care for the doctors to prescribe it so widely.
Right. That's
What about you,
interesting
Jay?
you say that, because the patient that I was thinking of was in her late 50s, early 60s, and she lost weight, but she was saying that her gait and her balance was off,
Mhm.
and so that could have been attributed to the muscle loss. Is what I thought.
Yeah,
But
I mean, that
listen,
sounds realistic to me. Yeah.
yeah, she was overcoming a injury, and I told her to speak to her physical therapist about it. Because
Oh, really? So you are referring out to physical? I've never heard a pharmacist doing that before.
she was already doing physical therapy, and she was like, I feel like my
Uh,
balance. I was like, you should, next time you go there, you should talk to them maybe. And she's like, can it be this weight loss drug? And I said, if you're losing muscle, yeah, it can be.
Yeah, I'll tell you again, clinically, I don't know how big it is on people's radars right now. I know it's being prescribed again in the physician's office, and you may have patients who are coming in, but I don't think this has been I didn't find really any PT heavy research on it. Like there hasn't been a ton
Yeah,
on
there
it,
hasn't
but
been. Yeah.
yeah. And so I think it's going to be something that's going to be looked at because as they go through this and they continue to find, like you're seeing the orthopedic world talk about, stuff around the lean muscle loss and the lean mass loss. And then they're talking a bit about the, bone structure and stuff. And
Bone
it's like,
density and bone structure. Yeah, I read a
yeah,
study
it's
about
kind of
that. It's
concerning.
affecting, because once muscles, then after that, it's bone density, right?
bone. Right.
Yeah.
And so
Right.
the question is going to become is, well, who's going to be able to manage these patients? Because an orthopedic doctor is not going to, manage that. I mean, what this is very similar to like, you know, people who are aging or people who have osteoporosis and stuff, and going to a clinician who's skilled in the musculoskeletal system, and that's what PT is, right? So that's where I think we're going to have to step up, and it'll be interesting to see if there's a like a call to arms to kind of really train people, get people up to speed on what the data is, and really advocate for, hey, we need to be out there really making sure that these patients are to your point, being more active, managing their pulling nutrition into this and managing the nutrition piece, and then making sure that they're doing exercising and strengthening and all those kinds of things. So there's not that loss, and it's just kind of balancing out, and they're just going in the right direction, and all the other vitals and stuff are getting better.
Right.
Is there anybody that you advise not to take Ozempic? Like contraindications or anything?
Yeah, I mean, the one is like if your doctor feels like you're not categorized as obese. Some people, just for personal or cosmetic reasons, I wouldn't really recommend it. Then also people that have like gastric disorders, it could worsen the gastric disorders that they have, stomach emptying. You got to be careful with patients maybe that have Crohn's and so on and so forth. So, because you're trying, you're losing also a lot of nutrients, right? So when you want to replenish that, you have to have an actual really good digestive system and absorb the nutrients that you're basically not getting because you're not eating as much.
All right. Yeah. Well, that makes sense. Jay, did you have any other medications that you commonly see in the PT clinic? You wanted to ask Neema? I have a whole list. So.
Yeah. Well, definitely one of the ones that we see, especially in a clinic that I was in prior, was doctors and even nurse practitioners would prescribe a lot of gabapentin.
Oh yeah.
And that was for managing patients with a lot of pain, back pain, those kinds of things. You want to share your thoughts and things we should be more aware of in regards to that? I mean, I'd love to hear your perspective.
Sure. I mean, gabapentin is a very well-known drug. It's utilized, by so many patients, and mechanism of action is that it reduces excitatory nerve signaling. I usually see it in neuropathic pain. So you'll see it with patients with type 2 diabetes. I've seen it with patients with sciatica, fibromyalgia, and basically like it takes care of neuropathy. The downside that we always talk to patients about when we do the counseling for this drug is drowsiness, dizziness, and poor coordination. And so that's going to kind of tie into the previous question I had that, it can improve with pain control, but it can also worsen balance. And patients may feel better, but they may also be at a greater fall risk, right?
Mhm.
So have you guys experienced anything like this that, we're telling them to be careful? I don't know if someone is now controlled in pain, but it might lead to an injury because they're on gabapentin. Do you guys see any patients that are currently on it for their pain?
Oh yeah. Almost everybody that has some form of nerve pain or sciatica is
Right.
usually going to get some form of it. But I think where I see the bigger effects is out of my scope. But people are struggling mentally by taking it. They're telling me that their thought process is slower. They're having trouble finding words.
Yeah, I've
They're
seen
having
that. I've
trouble,
seen that.
like cognition problems. Where
Yeah, there's
they,
definitely a cognitive component, like a side effect of that, where their cognitive is a little slightly impaired. I've also seen that, experienced that as well. Um, Now with gabapentin, there's capsules that most people take. We're an integrative compounding pharmacy, so we make personalized products here, and so we do also offer like gabapentin in a transdermal cream form that patients can apply directly to the site. Yes, and they've also combined gabapentin with maybe an anti-inflammatory. So you're getting that you're
Oh,
controlling that neuropathic pain, but if there's any inflammation, you can kind of create a customized formula. So some patients do better with that. They also notice that they don't get as many side effects at times because it's not circulating throughout the entire body. It's
bloodstream. Yeah.
more localized
Oh,
treatment. So
that's really interesting. So, it's used just topically like a cream on well, I come in with low back pain and be like, okay, we're gonna just give you the cream. You're gonna apply it there, and that's gonna help you with your pain.
yeah, gabapentin is very commonly used with when it comes to creating a custom formula or a personalized product. It is prescription, but there's a lot of orthopedic doctors and pain management doctors that will include gabapentin 6%, 8%, or 10%. And then
Hmm.
they'll add that to maybe, as I said, we see baclofen, amitriptyline, diclofenac, which is generic for Voltaren. And
oh, okay.
using this blend, they're allowed to help patients, get some pain relief. But you don't get sometimes if the patient is complaining about these side effects that we were talking about, they might not get that with a compounded cream or gel.
Got it. Oh,
Okay.
that's awesome.
So
Yeah.
if somebody came in, they're like, man, this is messing with my brain. Like I can't think right. At that point, you would say, well, let's try doing a different way. Let's try
Yeah, I work
topical.
with prescribers where they will take a different path once that patient has complained about the side effect, and typically they're at kind of the lowest dose. So I wouldn't say, when they're complaining about side effects, usually they'll step down a step or two in either how frequently they're taking it or the strength more commonly. But once you're kind of getting towards the bottom, and the patient is still complaining about I'm feeling dizzy, or I have poor coordination, or the mental focus that you were talking about, or memory and such, that's when the doctor might consider a customized compounded transdermal cream.
Okay. Got it. And
Yeah.
why don't they offer that like in, a lot of the hospitals and doctors? Is it like more expensive or, what would be the
I don't
reason
know.
be?
Maybe they haven't been educated. Maybe they
Yeah.
haven't had the proper tools to see what they can put into their bag, so that they can always use that as a tool.
They've never
Now
been to
I
Ion Pharmacy.
Yeah, maybe
exactly.
Ion Integrative Pharmacy can be a
Yeah.
source of education for that.
Well, I mean, I I guess that brings up another question. I know some patients, if they've been on it for a while, you have to wean them off. So I'm assuming with with this, like if you're mixing it and you're putting it on as a cream, you're not having to deal with those side effects either.
There's a lot less of a chance that I've seen. So I've come across less cases when someone goes from capsules to a cream. I'm not sure if this was also a question you were asking, is how do they titrate down? So if a doctor truly feels like they need to titrate off the drug and not just come completely off the drug, the doctor can create a customized system where based on that patient's symptoms, exactly. So they'll go from, let's say, I don't know, a certain strength, and then they'll go half that strength, and then start stepping down in 50% decreases incrementally till they get down to 20% of what they were taking, and then they'll come off. Yeah, it's called the customized titration schedule, and you can use pharmaceutical compounding to achieve that.
And that's because of a withdrawal effect if you come off of it too soon. Is that correct?
Yeah, some patients, they experience withdrawals. So one strategy that some prescribers have is to use pharmaceutical compounding to create customized strength and slowly decrease, make it more gradual. I have seen prescribers do this. Instead of taking somebody off a drug, they'll do it over 4 weeks, 6 weeks, or 8 weeks. It depends on how aggressively they want to come down. Some of them want to come down really slowly. And so some prescribers will take that route.
Okay, awesome.
So, the other one that we're seeing a lot, not just in our office, but in society, is the blood pressure meds, right? The statins. So I was wondering if you had any cool case studies or experiences where you were changing somebody's blood pressure meds because they had something that was mimicking like a musculoskeletal issue or something like that.
Yes. So I want to back up a step because statins help with cholesterol. I think you maybe
cholesterol, right?
Yeah, I think I was jumping ahead. Yeah, I was like, a side effect is muscle pain, right? But yeah, you're not taking it for muscle pain. I hope you're not.
So statins help reduce cholesterol, and they do that by reducing cholesterol production. So they block something called HMG-CoA reductase, and that doesn't allow your body to produce that cholesterol, and in turn will help lower your cholesterol levels. So people will take this for cardiovascular protection as well. So that a little bit ties into the blood pressure. But one of the common side effects is muscle aches, muscle weakness, and muscle cramps. Okay. And in fact, muscle pain can happen. There's something called creatine kinase, and that could be shown in blood levels. But the muscle pain can happen even when that's normal. So someone can say, I'm having muscle pain. Doctor says, well, I looked at your creatine kinase levels. It could still be attributed. It could still be caused by the statin drug. So statin drugs, it's very common, and that's something that prescribers and pharmacists really look for to see, is our patients complaining of this muscle ache, muscle weakness, muscle cramps. The tie into physical therapy is that not all soreness is exercise related. Because what happens when somebody is taking a statin drug, your doctor says, go and exercise, your cholesterol is high. You say, yes, doc. You go, you start exercising, you're like, man, I'm having a lot of muscle pain. Well, it's because you're exercising. Just go get some water, go watch a show. You don't know that it could be the statin drug that you're taking that's causing that those muscle cramps and that muscle weakness. Now, I think Randy was asking if I've ever experienced it. Yeah, I mean, not personally, but I've had a family member that came to me and said, I something is off. They went to another pharmacist. Pharmacist said things are normal, but I kind of dug deeper, and that we found out they went back to the doctor and they were on a statin drug, and it was causing muscle aches, and it was affecting them biking. They were like, every time I start biking, and they were stretching, they were drinking water, and it wasn't going away. And I said, this might be caused by your statin drug. And so they changed them to Zetia, a different drug with a different class. But this is something that I was wondering, wow, this, I read in pharmacy school that this is very common, but once you see it in real life, you wonder how many more people out there are having muscle aches due to this drug. And this is a very, very commonly prescribed drug. In fact, statin drugs are first line of therapy, usually when you have high cholesterol. And so there's ways to screen for this, but really, how does somebody know until you've actually started? You know, there's the levels that I was talking about that you could look at, but if you're healthy, you can still have those. And so, you ever come across this, Jay, Reddy, with your patients?
Yeah, but for me, I'm always I always wonder, is there a sign? Because I'm always not sure. I'm like, is this actual muscle pain or is this a interaction with their meds? So I don't know if either of you two have like some kind of a way of telling, or is there a certain description of their muscle pain that would lead you to say, oh, this could be more of a statin related muscle pain versus just, like you said, regular exercise soreness?
Jay, have you experienced? There's some reports that show that
Jay,
it
you
usually
got
happens less in the lower extremities, or do you kind of see it happening anywhere?
Yeah, historically, what I've seen, your patient will come in, you'll give them exercises, and they'll come in. They're like, I've been having this ache and pain, or you'll and they're like, I don't know if it's your exercises, and you're like trying to put your finger on it. You're like, no, you're gonna be sore, but then they're pointing at other areas that you're not really prescribing the exercises for, or they come in from the doctor and they're like, I've been having these aches and pains for a while. The doctor basically said, I thought it was statins because I read my side effects, and the doctor says, no, it can't be that, and they send me to you to figure it out, and then you go through the exam. Very rarely will you not find anything that's not like, doesn't line up to something musculoskeletal. But I mean, I've had a couple of cases over the years where it's like you go through and it's like nothing, there's nothing there. There's nothing which really lines up. And so you're like, I think this might be something you need to go back to your doctor and discuss, because it's not something that I'm going to be able to treat, right? So, I mean, in your integrative model, I think I just want to piggyback off of Randall. Is there any like test that a patient should or even a therapist should maybe talk to the physician about? Like, hey, you need to maybe look for a lab value in this to see if this might be driving the problem.
Yeah, the CK, the creatine kinase level. Yeah, those are a sign. And then other than that, it's just reporting what you're feeling.
So will those be elevated, the creatine kinase levels? Okay, got it. Well, I think that's very good to know.
Yeah, they'll typically be elevated. So something to watch for and to help patients with. Yeah.
Now, in your experience, though, in just what we've seen, I mean, I don't advise them to stop with the exercises if I feel they've got a weakness, because whether or not the statin is causing the pain, I still want them to be as healthy as they possibly can. So I'll continue to encourage them to do the exercises and such while they figure it out with their physician. From a pharmacological world, any issues with regards to that in terms of just continuing with the exercise?
I would say it depends on their goals, and it depends on their plans. So if it's very intense, then it's worth considering changing the drug. But if it's like low or mild, they should be okay. I think they experience a lot of the muscle soreness typically on moderate to high level of intensity exercise.
Got it.
So pushing pretty hard on a bike, running, they can still experience it in physical therapy, but I personally feel like it's a case-by-case basis, but maybe low to moderate, those should be okay. But if it's an aggressive, someone that's trying to work aggressively in physical therapy, I think they can consider switching.
Good
question.
Okay.
Yeah, I like that question a lot.
Great.
Yeah, I have these patients. I don't know if you have an answer for this, but I'm always mystified by it. But they'll tell me something along the lines of like, "Oh, I take Tylenol. It doesn't even touch the pain." I'll take Norco, doesn't even touch it. But if I take Advil, oh, that works pretty good. And I'm like, what is going on here? How is that possible? Or they'll like name 2 anti-inflammatories and like one works and one doesn't. I mean, is there like different mechanisms going on there with some of the pain meds where it would work for a certain type of?
I mean, with ibuprofen, it's it's a COX inhibitor, and Tylenol, it works centrally in the brain for pain relief. Personally, I feel like something that has ibuprofen in it can help with inflammation a little better. But of course, you got to watch for the stomach lining, and then Tylenol mentally a little bit more helps with pain, but way too much, obviously, you got to watch for liver damage. So I'd say that they do work differently in that way. It'd be very interesting to see why someone responds to one thing versus another. What's even more interesting is when somebody says, "Oh no, this company that makes this one, it works for me better than the other one, and it's the same exact drug." And I want to say,
or like generics don't work with me.
yeah, or like I've had people that say like, "This manufacturer, I'm telling you," and I'm like, "Wow, maybe their facility is really nice. We should go check it out together." It's something.
Yeah, exactly right.
They're using different ingredients.
I'm like, is it the state? Is it the air in the state? But they truly feel like there are people that are really sensitive, and this is the kind of patients we work with at Ion Integrative Pharmacy. We do hormone therapy. We make things that are customized in pediatrics even. So I'm not dismaying that somebody might feel like a product is more right for them. So jokes aside, that can happen because sometimes people will be sensitive to the inactive ingredients, and not every company is required to have the same inactive ingredients. So even the same drug made by different manufacturers can have different inactive ingredients. However, I'm just saying it's interesting when it's the same exact drug, and they said that they preferred this one or the other, and I don't have an answer for you, Randall, as to why that person will respond right to that one. I would say, my Tylenol, I personally feel like is good for pain, but again, it's weak for inflammation. I like ibuprofen more when there's inflammation. And so there's also people that talk about like Excedrin, and Excedrin has acetaminophen and aspirin and caffeine, excuse me. And that helps with mainly like headaches and migraines, but people say
that's great for hangovers.
It's good. It's good for hangovers, yeah. I mean, it has a nice blend there. It's a nice little hangover cocktail. They say, but I guess it's all what the patient responds to, and as long as they're taking it as prescribed or as instructed, it should be okay. But I always feel like working closely with their physical therapist, really doing the exercises and instructions, reaching their goals, being realistic and sticking with it, along with maybe taking medications and nutrition and taking, again, that integrative approach, to me, can lead to better results and outcomes.
Great. Awesome.
Neema, tell me the typical patient that's going to be your customer. So like, why is somebody going to respond to Ion Pharmacy and maybe not with, I'll just say CVS just because I live across the street from one, but like CVS,
Right. So somebody that feels like that strength is not working for them, that dosage form is not working for them. We just had examples today about a capsule of gabapentin, and you need it to be made in a cream. So that's not commercially available. Sometimes strengths are not commercially available. And maybe they've already tried, a medication, it hasn't worked for them at that strength in that dosage form. That's where pharmaceutical compounding and Ion Integrative Pharmacy can work closely with their doctor to see what other solution is out there and what we can make that's customized for them. A lot of the bases have been very well studied to help with penetration. The capsules are seen as very clean. We'd have less, inactive ingredients in there, and it allows for the body to absorb the medication and hopefully help the body also heal itself That's what we're very big on here, is assisting you to help you, assisting you in your recovery and in your treatments and in reaching your goals.
Yeah, Jay.
Some of the typical things that we help patients with are, customized hormone therapy, customized thyroid, dermatology. Sometimes some people have sensitivities to products out there, and so we will, make it with hypoallergenic bases. Sometimes they need customized strengths in dermatology as well. We're very big on women's health. Women, their ailments can be very complicated, and so they really need a higher level of care as well. And so not only are you getting your personalized product, but at Ion Integrative Pharmacy, you're also getting personalized care. So you're getting an integrative care, you're getting a personalized, team that really will take care of your needs.
What made you get into that?
Several reasons. My sister growing up, she was a cancer survivor. She tried 2 or 3 different medications, and she finally found one that worked for her. She's a stage 4 cancer survivor. So from there, I saw that one medication might work for someone and it might not work for somebody else. And then I had my own experiences making my first customized compound as a pharmacy technician, and I fell in love. It was actually for somebody with back pain, sciatica pain. Funny that we're talking about that topic today. Yeah.
Right.
And then the person came and they gave me really great feedback. They were like, the doctor wrote a really great blend, and you made something great for me. Thank you so much. It's helping me with my pain, and I'm also using other things to help me recover. I fell in love, and here I am.
That's awesome. That's really good. And we're just for the folks who will watch this, who are watching, who will how do they find you? Where are you at?
Thank you. We're in Torrance, California. We're in Southern California. We're licensed in the entire state of California, and we ship all throughout California. So we will, that's basically the area we cover. We're always expanding, and we love what we do here. We have a very passionate team. Our website is www.ionpharmacy.com. And if anybody has any questions about anything in this session, I'll be happy to answer them.
Awesome. Great.
Yeah. One last thing before we let you go. Tendon ruptures and antibiotics, right? There's been a correlation between the two.
Oh yeah, that's very important. That's actually another very important one because fluoroquinolones, they help with like respiratory infections, skin infections, UTIs, very commonly prescribed as well. Those you can have tendon pain, or even like it could rupture actually under high intensity exercises. Our professor in pharmacy school was telling us a story that somebody like didn't believe it, went and played soccer, kind of made me scared because I play soccer, and their tendon ruptured. They heard it, they went to the emergency. It's very serious. So a lot of the times these medications, they'll be like 7, 10, 14-day therapies. So I always say, if you can, hold off on those kind of exercises. It's not worth it for that to happen, dizziness, neuropathy can also happen, but tendon rupture, the risk actually can even carry a month or 2 or months later on. So any like new tendon pain that someone is experiencing on these medications are very important to discuss with the prescriber about that. And maybe even like first, maybe if they're even experiencing any physical therapy. Examples are like ciprofloxacin is very common, levofloxacin. These medications are used all the time at CVS, Walgreens. They're just, commonly dispensed. And so it's very important. It's in the guide. People are just like, whatever, but it's very important. Yeah. The tendon, muscles, joints, nerves, is very sensitive on these medications, so that's very important too.
Yeah,
All right.
it's interesting because we get so many patients who come post-operatively. They'll be on sometimes there's some post-op complications. They're on some what do you call it? I'm sorry, antibiotics. And so it's good to really pay attention to what's being prescribed and what people are on.
Yeah,
Because these are people who have just had surgeries on things such as tendons and such, and so it's good to pay attention to that. And I mean, you're not going to do anything post-operatively that strenuous, but still, it's good to be mindful of that. But I mean, even to the point of like if you've got somebody who had some other sort of infection and they're coming into your clinic with a new, muscle issue, it's good to be mindful of that for sure.
Or
right.
even
And let's go ahead.
I was going to say even like tissue healing time. I mean, I'm
Yes.
sure that would also be affected. If somebody did get let's say they tore their ACL and they're on these antibiotics because they had an infection post-surgery. I mean, they may be further along in the protocol, because
Yeah,
of tissue
right.
healing time.
Right. I mean, I I think all of these are really important. Medications can either support, your rehabilitation or complicate it. And understanding what your patient is taking can really explain why they might feel stronger or weaker, while they're feeling dizzy, inflamed, or maybe even in pain. So this is a really great topic today. And I'm really glad that we were able to talk about some of these medications that might, completely change how their physical therapy is approached or managed. And so, I was just curious, do you guys have any educational materials on the website? Maybe we can put something together, like top 10 medications that, physical therapists can look at for their patients.
Yeah, I
So we
mean,
can,
if you want to collaborate on a blog post, I mean, I'd be happy to do that because, like I said, I think a lot of older physical therapists like myself, our education in pharmaceuticals is minimal.
yeah, we can put together.
Most of what I've learned, I mean, I know I probably was taught it, but it kind of gets forgotten over the years. And, most of what
Sure.
I've learned is, like I said, in passing or quick discussion with a doctor or another therapist, So if we had just like kind of a blog post guide, not like medical advice or anything like that, but, just like a general guideline of like, hey, these are the ones you got to watch out for, post-op or, we'll talk
Sure.
later.
Yeah, we can make a blog post about that so
Mhm.
listeners can go check out maybe like a top 7 or top 10 medications to watch for.
All
Great.
right. Very nice. So
Yeah.
Jay has picked, you think Portugal's still going to win the World Cup?
God, they're looking horrible. They were my dark horse.
Yeah.
I mean, France was always there, but I was hoping Portugal might do something with that midfield, but they've looked atrocious. I don't know.
Yeah, last
Yeah.
match they look too good. Who's your team, Randy? Who do you think's going all the way?
I don't like. I mean, I never really want France to win ever since
Yeah.
we don't have Zidane anymore. But I did pick France pre-tournament to be the champions.
Okay.
And how about you, Neema? Who's your pick?
I pick France too, to be honest,
You pick
because they're
France, okay,
just,
boring,
oh my
right?
God, they're so deep. Even their bench, like the people on their bench, I'm like, you're on the bench. My dad picked Spain. We did a little family thing.
Yeah.
So,
I have watched some games at your house before.
oh yeah. My dad's really into it. So we've been just like catching as many games as we can. But I do think Mexico is going to go to semifinals because they are.
Mhm.
Oh,
they're looking-
that's going to be a game.
Yeah.
That England-Mexico game.
Oh
Oh
yeah.
my gosh.
Oh yeah.
Oh,
England's entering a
Oh.
buzzsaw. I don't know if they know what they're in for, but Azteca is not going to be a England-friendly venue.
Oh, that's just going to be. Oh my God.
That's the only
gonna be
game
great.
in the tournament right now that I kind of have circled on my calendar. I'm like, I'm watching this one start to finish,
Yeah.
And even like the days before, I'm like, what is Mexico going to do? What's the strategy? Because if they go too early, look, I've traveled with many British people to Mexico,
Uh-huh.
and they have a 75% chance of getting some kind of diarrhea in
Uh-huh.
their first week.
Or
So,
not getting any sleep from all the partying
Yeah,
outside.
so we're looking at that
Oh
factor.
yeah.
Yeah, all you sports gamblers out there, you know.
Yeah, they're putting roadblocks up so
I
that they
heard.
can't do what they did to
Yeah,
Ecuador.
yeah, I
But
heard.
yeah,
I'm
I mean,
sure someone sent an email like, listen, you need to block off
Yeah.
the road. Yeah.
yeah, yeah.
Anyway, we'll see what happens.
That's it.
But you know, but I have been in Mexico City before. There's this thing they have called fireworks, which travel across road blockages.
Yes.
Yeah.
You're right.
Exactly.
And
Yeah.
yeah, I don't know. I wouldn't order room service if I was England. I'm just put it that way.
No,
These
yeah.
people are going to do everything they can to
Yeah.
get their team to win, as they should. That's the whole point of hosting the World Cup.
That's home field advantage right there.
Exactly.
Mhm.
All right. Well, everybody,
All
check
right.
out Ion Pharmacy, ionpharmacy.com, correct?
That's right.
Yeah. And check out Neema. And he is single. Ladies out there.
Randall.
man.
Oh, man.
Just messing with this guy.
Oh, this guy. Thanks for having me,
But,
guys. I
no-
really appreciate your time today.
All right.
Yeah.
Thanks again.
All right. Ion Physical Therapy. But seriously, you gave us so much information. I really appreciate it.
Oh,
Yeah,
anytime.
it's great.
To have you back on when anytime new meds come out to ask you about it. You're a great resource for all the PTs we interact with.
I would love to help you guys. Thanks again for having me.
Yeah.
Appreciate that.
All right. Take care.
All right. Take care.
All right, take
have
care,
a nice
Jay.
day,
All right.
guys.
All right.
Yeah. And then everybody check out our courses that we have up. You know, we have a tennis elbow course inside a winery. Jay and I are teaching that one. We have a vestibular course in Hawaii on September 26th. And we have a cupping class, myofascial decompression, with Chris DePrado, the cup father. He's going to be in Las Vegas October 24th and 25th. So we have, if you take that one, you're going to get a complimentary cupping kit with it. And Jay and I are working with some other goodies for you guys as well to try to get everyone some discounts on some exercise equipment and whatnot in the future. So give Jetset Rehab ED a follow. Subscribe to our YouTube if you're watching this. And then check
Like
out
and subscribe.
Ion Pharmacy. Yeah, like and subscribe.
That's it.
All right.
All right.
Everybody, have
Thanks.
a great evening and have a great 4th of July weekend. Peace out.
You too. Happy 250 US.
Yeah,
250.
50, man. We haven't gotten there yet. All right, bye,
All
guys.
right. All right. See ya.